All right, good afternoon, everybody. Today is Thursday, April the 2nd. I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. I am joined, as always, by my fellow commissioners, Vice Chair Ken Lawrence and Commissioner Joe Gale, as well as Dr. Brenda Weiss, the Administrator for our Office of Public Health, and Dr. Al Wong, Regional EMS Director. Since our briefing yesterday on April 1st, we have gotten notice of 113 new positive cases of COVID-19 in Montgomery County, which brings us to a total of 707. These positive individuals are from 35 municipalities, 2 of which are reporting their first cases. Bridgeport Borough has 2, and Red Hill Borough has 1. This moves us to 55 of our 62 municipalities that are home to individuals with COVID-19. Today, these individuals range in age from 1 month to 94 years old. As always, you can check the county map at montcopa.org/COVID-19 to see these totals updated probably by now. Actually, they usually do it as we start this press briefing. The age brackets, we have 4 individuals, 0 to 9, 9 individuals, 10 to 19, 15 individuals between 20 and 29, 22 individuals between 30 and 39, 21 individuals between 40 and 49, 16 individuals between 50 and 59, 12 between 60 and 69, 8 between 70 and 79, 5 between 80 and 89, and 1 between 90 and 99. We have 62 females, 48 males, and 3 that are unknown. 6 of these individuals are hospitalized, 58 are at home in isolation, and 49 are unknown. I again am saddened to confirm that there are 2 more Montgomery County residents that have lost their lives to COVID-19, which brings us to a total of 12 deaths. The first individual was a 79-year-old male from Springfield Township. The second was an 86-year-old male from Upper Providence Township. Both passed away while in a hospital, and both had underlying medical conditions. So we have 2 charts today to try to help people understand the way that we are reporting these new positive cases. Because, for instance, today we reported a pretty big number, which was 113. But I want people to understand that that doesn't mean that we had this huge surge of new cases today. So this graph to your right, my left, just gives you a snapshot of the test results that have come in from our community-based testing site since it opened, and you can see how highly variable those test results are each day. That's just the absolute number of new cases that have come in by day. So if you look at this smaller graph, this is our total number of cases over time, and then this bigger graph is a blow-up of these yellow bars. And that just shows the new cases by day. So you can get the sense of, we get these lab results back. Sometimes we get 20 from a commercial lab, and the next day we might get 80 from the commercial lab. So that's just the hit or miss daily variation that we have. Now over here to my right, to your left, is what we're tracking. And this is what we track very carefully. And this is a chart that shows the number of tests that were run on each of those days. That's on the x-axis. And we have together with that the number of positive results returned for that day. So the blue is the number of tests that were run on any given day, and that orange bar on top shows the number of positive results for that particular day. And you can see that that orange bar is a pretty stable thickness. We are consistently seeing that about 13 to 15% of all the individuals that we test come back with a positive test. And this is the percentage that we're keeping a close eye on, not so much these day-to-day variations. Because if we do start to see an increase our number of cases, and that would represent a surge, what we're going to start to see is that the percentage of cases that are positive each day starts to increase. And happily, so far, we are not seeing that. We've had pretty steady from the beginning of this. 13 to 15% of the people that we test come back positive. We do absolutely anticipate that we will see higher percentages of patients start to turn positive in the days ahead. We continue to check modeling on a daily basis. The modeling still suggests that middle of the month is about the time that we would expect to see our peak number of cases. And again, just as a reminder, the more everybody stays home, the lower that peak number of cases is going to be. And that our goal, by asking all of you to stay home, is to protect our hospitals from too many patients, more patients than they can handle, to protect our first responders, to make sure that they are not sick, that they're able to transport people to the hospital and keep our communities safe, and to protect all the people that must go to work every day. Right in front of me, behind you, you can't see them, is a whole room of telecommunicators that are answering your calls to 911. These are the types of people that we are trying to keep safe and healthy, because it's critically important that they come to work every single day. So please stay home. Please minimize your trips. Okay to go out for a walk, but just do it with the people in your household, or stay 6 feet away from whoever you're walking with. These are the key steps to getting this over as quickly as possible, and to making sure that whatever our peak looks like, it's a peak that we'll be able to manage. And with that, I'm going to turn over to Commissioner Ken Lawrence.
Good afternoon. I want to share an important announcement from our prothonotary, Noah Marlier, about protection from abuse PFA filings. If you or your child are being abused in the home, this is considered an emergency matter by the court, and you still have access to services. The Office of the Prothonotary is still accepting applications for protection from abuse orders, PFAs. Under the emergency declaration, the Prothonotary's office is open Monday through Friday for PFA filings from 9 a.m. to 2 p.m. However, processing stops at 1 p.m., so applicants should arrive prior to noon. You can call 610-278-1191 for more information, and that's 610-278-1191. And the COVID-19 stay-at-home order does not mean you have to tolerate unsafe conditions in your home, so if you need help, please contact the office or come in for a filing. From our Commerce Department, I wanted to give some information about the Paycheck Protection Program. The U.S. Treasury's Paycheck Protection Program authorizes up to $349 billion towards job retention and certain other expenses to assist small businesses. Eligible parties include small businesses and eligible nonprofit organizations, veterans organizations, and tribal businesses described in the Small Business Act, in addition to self-employed individuals and independent contractors, provided they meet all program size standards. So you can visit the website for the Department of the Treasury at www.treasury.gov/cares to learn more about this program or access the program application. And we just wanted to give you an update on the Monco COVID-19 fund. We've raised over $30,000 from individuals at this point. We have 60 grant applications that have been received. No grants have been awarded yet, but we are still looking for funds. So if you can donate at www.moncopa.org/COVID-19. And once again, this is raising money for nonprofit organizations in our community. This is not raising money for county government. This is money that will go directly back into the community to help safety net organizations who are helping our most vulnerable citizens. So we thank everyone who has supported so far. And with that, I'll turn it over to Commissioner Joe Gale.
Good afternoon, everyone. I'm Montgomery County Commissioner Joe Gale. Southeastern Pennsylvania, which is comprised of Bucks, Chester, Delaware, and Montgomery counties, as well as the city of Philadelphia, was the first region of Pennsylvania to be impacted by the coronavirus pandemic, and the region most seriously impacted by the public health emergency. Additionally, the southeastern region of the state is responsible for generating nearly 40% of Pennsylvania's economic output. So those 5 counties are responsible for nearly 40% of the state's economic output. Our region's ability to recover from this crisis is essential for the long-term fiscal security of the entire Commonwealth. We greatly appreciate the state supporting a loan program for small businesses, but we are requesting that the funding allocations be proportionally based rather than simply a first-come, first-served basis. By ensuring that each region is allocated an appropriate and proportional share of funding, we believe that the entire state will achieve the most economic benefit. We will continue to work with our neighboring counties and the governor to help local businesses get through this difficult time. I will be providing additional updates on this effort as they develop. Thank you very much, and we'll turn it back to Dr. Arbush.
Thank you. So that was just one example of how we are working together collaboratively as a region across the 5 counties. We speak, the elected leaders of the 5 counties have a call together every day, and we touch base every day, so we have a good sense of what's happening across our entire region. As we've talked about, this virus doesn't care about government borders or any borders, frankly, so we do stay in daily touch. We've also been working very closely with our hospitals and stay in close touch with them and speak to them at least once a week in some fashion, and sometimes more times than that. And we have a regular call every Friday with our faith community. Any members of the faith community that want to hop on that call are welcome. These are leaders of our faith institutions, and we give them an update on what's going on in the county and guidance and other suggestions about social distancing, those types of things. We certainly have urged them not to hold any services that would bring more than a couple of people together that would be closer than 6 feet apart. And so that's just a couple examples of what we're doing every day, day in, day out, to keep this whole community together and make sure that people have the information that they need, they have an opportunity to ask questions from credible sources, and that we have an awareness of just what's happening around the county. The other group that we check in with regularly is the Montgomery County Intermediate Unit, which is keeping in close contact with our 22 school districts to see if there's anything that they need. So just want to reassure people that we are working to do the best we can to keep in touch with all of the folks around our region and give them the information and the support that they need. And with that, I will take questions.
With speaking with hospitals, is there an update on how availability of beds, of ICU, is there any update on that?
Yeah, so all of our hospitals do still have capacity, both in their regular beds and in their ICU beds. I don't have precise numbers, but as I think I mentioned the other day, our hospitals have, I think at this point, entirely canceled anything that's elective, meaning that it's not urgently necessary for the health or life of that person. So they do have open beds right now, and they're staying that way so that they are prepared for what we anticipate will be an increased need for those beds.
Do you have, and I know this is the question we've talked about with the, when we might see a peak, is there an anticipation of when that increase for hospitals would come? Would that coincide with the peak in 2 weeks? Again, all hypothetical, all modeling.
So that's actually a good question. Not necessarily. If the number of positive cases peaks in around 10 days to 2 weeks, then the need for hospitalization could actually peak a week or so after that. We're seeing with this disease that people sometimes are okay for the first 4, 5, 6 days of it, and then does seem to be a subset of people that take a turn for the worse. So they might be at home in the early stages, but then require hospitalization later on. I think the other thing that we'll see as this goes on is that even when we get to the point where we have 0 or very few new cases on a given day, we sadly might still be seeing people that are losing their life to COVID-19 because they're lagging that, right? They're a couple weeks in. So That's a very appropriate observation, that these numbers are not going to be entirely in sync. And so when I look out at those 2 weeks, it's sort of when we expect to see high number of cases, highest number of cases, but not necessarily will that correlate with the highest need for hospital beds. It could, but it might not.
Where are we on the situation with the Limerick power plant? Have you had successful communications to get some of your answered successfully, or some of your questions answered successfully, I should say?
We did receive some of the information that we asked for yesterday. We had another phone call with them today, and our Office of Public Health sat down today to review what we had been sent yesterday. That generated some additional questions, and those are being communicated in.
The spokesperson for the company had said that there were positive cases of employees there before the shutdown, before the work began. Have we seen any positive cases related to the work or the site since the work has started?
I really need to refer you to Exelon for who's being tested, how many people are in quarantine, that sort of thing.
How would you describe your reaction to the information that you've gotten? Is it helpful, or are you still concerned?
The information is helpful, and I remain deeply concerned that this refueling, maintenance refueling will ultimately contribute to the number of people that are exposed to the coronavirus in our region.
Do you feel that you have been given answers honestly and appropriately? Do you feel like you were given the start date, this is when they're going to show up, or do you feel like they showed up without your knowledge?
I do not have an accurate start date. I've asked for that. I have not received that. I do believe that specific information that I've received in the last 24 hours is accurate. I don't have any reason to think that it isn't, but we do have additional questions that we've asked that we haven't received answers to yet. I've been told that they're coming. And then as we sat down today with the Office of Public Health and reviewed the data, they had some additional questions. So we were getting those to them.
Let me flip that.
Let me just say that we have established a daily communication from Exelon to our Office of Public Health. So that's a good step.
If I could flip that question on its head, throughout this process, do you feel that you've been misled at any time?
I believe we were misled on the start date. We were always told March 30th. An EPI alert went out, which is an event of potential public interest, on Friday the 29th, saying that they were starting that evening. We've also been told by others that there were actually quite a large number of people here for a number of days before that.
27th.
Was it the 27th? The EPI? Yeah, I'm sorry, Friday the 27th. That was when they actually sent out the notice that they were starting.
But Sunday, Friday was it?
Correct.
It appears as though they don't really have control over everyone, because these people are not all of their employees. And the way that it appears to an outsider is these are contractors coming in that make their decision on where they're staying, and they don't really report that to the company. Is there a way to get that, at least for this project, to change? Because you won't know where these people go from here. If they're going to stay in another hotel, if they're going to go to a nuclear power plant in Maryland, if they're going to go to a plant in Beaver, and continue spreading this. So how do you get them to...
We have asked for the permanent address and the lodging information for everybody that is here associated with the outage, whether they live here locally and are driving there every day or came from somewhere else. We were told that the contractors that employ them, work with them to help them with lodging and other things. They sent out a survey. Again, this is what we were told. We've received information back from Exelon on about 950 of those individuals. They are staying all over the Tri-County area, actually 4-county, because I think there's some in Berks,
Some in Lehigh.
Monco, Chester, Lehigh. Some people are driving from other states every day. It's quite a lot.
Staying with friends?
Staying with friends, staying in rental units, Airbnbs, private residences, yes, campsites. So one of the many recommendations I have made is that we are in the situation that we are in here. But I believe that they have an obligation to not only the families of these workers, but whatever community they may be going next to do a refuel, that these individuals should be sequestered for 14 days before they leave here, so that at least when they leave, they can be fairly assured that they have no disease. And then wherever they go next, you know, in the perfect world, before they started another refuel, they would be sequestered for 14 days. They would be sequestered for the entire period of the outage, and then they would be sequestered on the back end for 14 days. I have to say that, you know, these communities, like our community, we have a lot of people that are sworn to run into the Limerick generating station if there's ever an accident. Many of those individuals are volunteer firefighters. And I think our community deserves to be treated better than this.
It seems like this is a symptom of a larger problem down the road. If they can't produce on demand a list of everybody that's working in a nuclear power plant and where they're from, it seems like basic information for something of such a high level.
I'm speaking about this publicly because not only do I believe the people in our community here in southeastern Pennsylvania have the right to know about this, but I hope that this is a cautionary note to wherever they're going next. I know that this is the normal way of doing business. They tend to do these refuelings in the spring or the fall because there are lower energy demands during that time, so obviously that makes perfect sense. But we're in an extraordinary situation. We are in a pandemic that is nothing like any of us who are alive today have ever seen. And extraordinary situations require extraordinary responses. And I do believe that they have a responsibility to wherever they go next to do it better than they did it here.
One of the problems also I'm seeing, I know we keep asking about this, so my last 1 minute, but I can't seem to find who regulates them. Everybody says they're exempt because they're federal. So they don't have to answer to the Pennsylvania Utility Commission, they don't have to answer to you, they don't have to answer to the governor's office, they can just go and do as they please.
So there will be many after action items, and this will be one that is on my list, in that as we were working through this challenge, it was not clear at all to our solicitor who actually had the authority to stop this.
And maybe they knew that going into it, so therefore they knew
I
that
can't
they
speak
could
for them.
just-
You should ask them that question. Yes. Todd, anything from outside?
Nope.
Okay. All right. Stay safe out there, everybody. Thank you.